Good afternoon, everyone, and welcome back to the Supported Employment and Education Program Career Pathway Series. This month, we are focusing on the field of medical, and today we have Jakarta Burnett, who is a medical assistant, and she's going to share information about her career pathway. So, Jamara, can you tell me about where you work and what you do there?
Okay, so I work at MacGyver's Foot Clinic. I work with a variety of patients ranging between the ages of 6 to however old I mean, the oldest you can be. And I do vital signs. I do ingrown toenails. I diagnose patients with whatever their problem is. I also assist with procedures. Um, that's really it. And I just interact with the patients and build like a relationship so they're comfortable when they come. They don't have to worry about being scared of being injected when they're having a procedure done or worrying about just life basically. We talk about literally everything.
Absolutely.
And what is your official title?
I'm medical assistant.
Medical assistant, okay.
And so you talked about that relationship building part. So what skill set, and you may have it naturally, that customer service, that helping someone get comfortable, right? I mean, you're talking about procedures and things, so that can be scary for someone to come in. How do you utilize your skills to, build those relationships with the people who are coming in for support?
Well, I worked in customer service since I was 16.
Okay.
So I have kind of like a natural flow of feeling the vibe of a person before,
Yeah.
like actually talking to them, like if they're approachable, if they're not approachable,
Yeah.
or like if they're having a bad day, try and brighten the day up with like an icebreaker or something like that.
Absolutely. So, what were some of those skills you think that transferred from that customer service job to being a medical assistant?
I'm dealing with a wide variety of people and different attitudes and the way how different people interact differently. Like,
Yeah.
so, I mean, that's really it.
Yeah, the customer service, and so you assist with procedures.
Yeah.
Tell me about that. How does that?
So we
how
do
does that
like
go?
ingrown nail procedures, like we remove nails,
Okay.
like discolored nails, or if they have like an infected toenail, we'll remove the toenail. So they will have to be numbed up for the procedure. So
Okay.
I will do all the numbing, and then I'll do the procedure afterwards.
Oh wow! So you do those?
Yes.
That is so cool. And so, did you have any specific training for knowing how to numb the medication, how much to put? Is that when you did your medical assistant certification? Was that included in that?
That was included in
Okay.
the certification of knowing the right medicine, the right place to put the medicine, the right needle to use,
Mm.
just making sure it's completely, the medicine isn't expired. Like you have to know exactly to the T so no one is hurt or injured or something
Absolutely.
goes wrong.
Is there
I-
preparation? Oh, sorry about that, Tiff. Go ahead.
I was gonna ask, with your education, was this like something that was like a specialty? Because like I know like medical assistants, you can work in any type of doctor office or like hospital. For podiatry, like was that something specific that you learned in
Well,
school,
good
or how did
question.
you learn about
Um,
that?
In school, I learned the basics of medical assistant, and the podiatrist that I work for, he taught me most of the stuff that I know
Okay.
when it comes to dealing with the foot, the anatomy of the foot. In school, you only learn about the anatomy of the body, the whole body.
Okay.
You don't really learn about the foot.
The specifics.
Yeah.
Was that something that you wanted to get into with podiatry, or how did that come to be that
It
you're
was
there?
crazy. So I don't like feet. Like I,
That question.
like I don't like feet. So I did my externship there,
Okay.
and I grew to love it as I started working there more and more. With that, the challenging part was to see and touch people's feet. Like I just like I was grossed out by feet before I started. So it was the foot. It connects to the whole body. If you don't have your feet, you can't do anything. So
Absolutely.
it's like,
Yes.
okay, maybe this might work, So I learned it and I was like, okay, I like it. And you learn so much more about the foot when you work there.
Mm.
Yeah.
And people talk about that, like that being one of most important? Like if your feet are in pain, you know, just your daily quality of life can be,
Painful.
you know, can be painful. How do you deal with that when people are coming in pain? You know, their quality of life is probably impacted by you know, their toe. You know, how do you deal with that? How do you help them get through and get comfortable?
Well, that's what comes with building a relationship with the patients. We see like a routine of patients, like every 3 months we see like the same patient. So I've been there for a while now. So now that I know the patient and I know like exactly what they go through, I try and relate to it in some kind of way pertaining to me. Like, oh, I've been there. You can do it, or just motivate them to like let them know like they're not in here by themselves. We're not here to harm them. We're here to help them.
Yes. How long have you been at MacGyver's Foot Care?
It'll be a year come June.
Okay.
Come June, it'll be a year.
And that's including your externship too? Okay.
And how did that get chosen as your spot? Did your medical assistant, the school, help you with placement? Is that something that you had to find yourself?
Yeah, the school helped me with placement. She thought I would learn a lot more from the doctor, and I actually am learning a lot. He teaches me. He doesn't know. Well, in school they had to learn about the body and the foot, but the 3 years of their schooling they have to learn more about the body.
Okay.
And then the last 2 years will be just the foot. So he knows about the whole anatomy of the body. So we still talk about the body and we talk about the foot.
So it sounds like there's ongoing learning occurring as well.
Definitely.
Is it helping you shape what's next for you?
It's helping me decide if I want to do podiatry for a longer time, or do I want to go off into like internal medicine or pediatrics. So I'm undecided, kind of.
But you have options to go in the other lanes with your medical assistant certification?
Yes.
Yes. Can you tell me more about that, the medical assistant certification? How did you get off into that? What led you there? What was it like? Tell us more about that.
It started when I was taking care of my granddad. I was taking care of my granddad for a while before he passed. So once he passed, I was like, okay, maybe I do want to work with people more into like the medicine field. I'm like, so I thought about medical assistant. It'll be just a jump to me being a registered nurse. I have a lot of aunts and uncles that are registered nurse, licensed nurse practitioners. So with that, I was like, okay, let me try it. Let's see if I really like it. And I did. I loved it actually. In school, we learned about everything, just literally from insurance to like literally everything you have to do dealing with like medical assistant or people.
What else is in that list? So like insurance, you were saying. So like insurance for the patient and how to process all of those things.
How to process it, the primaries, the HMOs and stuff like that. We learned about literally everything.
For that piece, for sure.
Yeah.
It's a huge part.
It definitely is.
Yeah.
Definitely. And because patients are very upset if the insurance doesn't cover things.
Yeah.
So yeah.
That's one of them. What are some of the other things? So I know that you talked about like the needles and medicine. All of those things were learned during the medical assistant program.
And then CPR. I also have my certification and my license for CPR. So we learned about that's a separate class that we had to take.
Okay.
But that's an everyday thing. Like somebody can like fall out right now, and I know how to bring them back to life with no problem. So, I mean, it wasn't hard at all, but you just have to be focused and ready to really want to do it.
Okay. Absolutely.
And how long is the program, the certification?
The program was only 6 months.
Okay.
It was a 6 months program.
How did you learn about that program? Did you just do some research, or you were already knowledgeable from family?
I just did research. I was never one of the kids that wanted to be in school for a long time. So 6 months was not bad for
me. You can see that.
I can definitely do 6 months. And now that I'm doing or finished that, I think I want to go back. I'm not for sure yet. I'm still deciding on if I want to go back to be the registered nurse.
Okay.
And I was going to ask, like, what helped determine because I feel like there's a lot of different programs out here. What helped you to choose the program that you went into? Especially since you did a lot of research, like, what were some of the factors that you were looking at when choosing?
Well, it was the less amount of time in school for sure. And more of it was I can learn and do things at my own pace.
Okay.
And if I can do it at my own pace, then that's fine. If I have questions, they were always there to help me. So it wasn't really any bad factors about it.
Good.
Yeah, not really any bad factors.
Now, you then, if I'm doing the math right, may have started school then during the pandemic?
I did. So I was
Okay.
we were doing online classes.
Okay, that's what I was gonna ask. Were you able to get any practical experience prior to your externship?
So, with that, we did online for the first 4 months, and then the last 2 months we did hands-on learning on
Okay.
each other. So we were working on each other
Okay,
in school.
okay, that's good, cause I'm wondering how that all works out with,
Yeah,
individuals that are in school that are doing hands-on type of work, that's, a challenging thing that we
definitely.
face. Okay. So what do you, what do you find to be the most challenging part of your job?
I don't find anything challenging right now. I don't have any challenges when it comes to certain things. Like if I don't know something, I always ask the doctor. He'll always assist me or like instruct me on how to do it or what to do or what not to do. So I really don't have any challenges.
Okay. Well, then, how would you say you dealt with like difficult patients? Like what do you do when you face
I
that?
always try and keep a positive attitude.
Okay.
The more you're positive, the less it like affects you, and the patients will see like, okay, she's not bothered by what I'm saying, so maybe I should just leave her alone, or maybe I should try and talk to her and see exactly like who she is. Because a lot of patients, when I first got there, they wouldn't speak to me. They were just looking like, okay, so who is this? Until I introduced myself, and they was like, okay, she's okay. So now when I come in or they come in, they'll be like, how you doing, Miss Jones? She'll be like, oh, I'm okay today, girl. But
Because you've built that rapport and those relationships.
yeah, so I mean, that's really good.
And it sounds like just you're working really closely like with the doctor who's also a part of the team.
Well, it's only 3 of us. It's me,
Okay.
the doctor, and the receptionist. So it's a small team, very small team.
So you have to. Attendance is very important
Definitely.
with your role. It sounds like it's 3 of you all. It's a small, clinic. Tell me about that focus. You talked about focus before with finishing school. What about that focus and keeping that positivity during the week? There's so much going on. There's COVID. We all have so much going on in our lives, but it sounds like you show up, you have a great attitude, and still follow through on things. How do you manage that?
When I feel like I'm overwhelmed, I just take a time to go to the side and kind of breathe a little and just think positively. Like, okay, I can do this. I can finish the day. We only got a couple more people. No telling if they're bad or not or how their attitudes are. So I just try and be positive, basically, and breathe. That's my main thing. I breathe.
Do you take when you're feeling overwhelmed, you intentionally take a few minutes for yourself to do that?
Yeah, I'll like step
positive
outside or
self-talk.
something, like get some air, and then come back in. And I'll be like, okay, we got this. We can finish this off.
Exactly, and that self-talk, that positive self-talk. How important do you think that is for someone who is entering the job world for the first time? Tell me about how important positive self-talk is.
Positive self-talk is very, very important. Like if you believe in yourself, then you don't have nothing to worry about. And just keep encouraging yourself to keep pushing and doing better. Like that's really all I can say.
Absolutely. Yeah, and it sounds like it's one of your tools to stay focused throughout the day, to kind of rebalance yourself.
Yeah.
So it sounds like a powerful tool. And we're talking about tool sets, with new workers, or young adults who are just about to enter the work field.
Yeah.
Like what are some of the skills that they should focus on when entering any job? What would your advice be to them?
Definitely attendance is one of the big factors, and then try and work as hard as you can. I wouldn't say work as hard as you can, but move at your own pace and show them that you can do it. Like as long as you show them you can do it, they're gonna have faith that you can do it. So just stay focused, really.
Oh yeah, that focus. So that focus was a big part of you finishing school and now being successful in your current role.
Yes.
Yes.
Definitely.
Okay.
How would you say the doctor plays a role in your growth in your position?
The doctor plays a big role in my growth because he still teaches me till this day. Like before I left today, we had a discussion about something, or charting, or something being wrong in the charts. Like constructive criticism is what I would call it. So he shows me a lot.
Yeah. And I say that because a lot of our young people that we work with, we really try to focus on mentorship and finding somebody in your life, whether it's like learning those life skills or in your career field, and trying to find somebody to follow after and see and how they do it. And would you say that, you've been able to have that? You said you had some family that have been in the medical field. Do you have any mentors that you say that you learned from?
I don't really have any mentors. I mean, I have a lot of mentors, I should say, but they all tell me something that I can use. It's nothing that is unusable, I should say.
And being open to that. Being open to receiving
different opinions and trying to figure out which one works best for me.
Absolutely.
Yeah, that makes sense.
Charting. Tell me about the importance of that and what skills are involved in charting. What is charting?
Charting is when you take the vitals and you're just basically all the patient's information on why they're there, what's the diagnosis, how long have they had the pain, and stuff like that. It's very important that you're very detailed and that you don't miss anything, because that plays a big role in the insurance and the billing. So if it's incorrect, then they could be billed wrong, or they could be not paid for at all, or not covered through the insurance. So charting is very important.
Very important. And you said you all had a discussion about that. Sorry. Did you have a discussion about that today? Was there something that needed to be corrected or updated?
It was something that wasn't detailed enough.
Okay.
Something that could have had more detail put into it. So he instructed me, and I fixed it, and it was fine.
Excellent.
So interviewing skills in a way. You need to probably have being able to dig deeper and ask particular questions to, is that what maybe was the issue there with this particular situation? I'm trying to get my phrasing right.
Yeah, okay, because
yeah,
kind of okay. So I think I get what you're saying. With the chart, okay. Can you
So
repeat the
I guess my question is it's not just necessarily I'm sure there's a certain routine of questions that you have to ask, but then would you say that knowing how to interview an individual, so asking them more digging deeper into those questions,
Maybe knowing how to ask the question.
Yeah.
Thank you.
Yeah.
Okay, yeah.
Where I'm struggling right now. But.
What I'm talking about right now.
So some people will come in and be like, I'm here because my foot hurt.
Right.
Okay, what's wrong with your foot? Why is your foot hurting? How long has it been hurting? Have you tried to treat it? What did you do? Have you seen a podiatrist before? Or I just ask questions that gets all the answers to what we really need to know, and buckle down to find out what exactly is the problem.
To kind of get to the treatment plan. Okay. Yeah. Because some people probably wouldn't know, right? I know that I'm in pain. So you have to go on a whole investigation.
How long is the pain, or when did the pain start? Have you went to the doctor? Did you go to the ER? People come in with ingrowns and pain. They have went somewhere before and had antibiotics to treat it. So if they don't tell us that and we treat it as well, it's like they're taking double dosages, and we don't want them taking double dosages. So we try and get to the major point of why they're there.
Right. And you said that you all see they have to come back often, or on some type of regimen to stay well.
Yes.
Okay.
Those are patients who have diabetes and they can't clip their own toenails, so we see them every 3 months.
Oh, I didn't know that. Do they have to get it done by you all?
Professionally, yes.
Oh, okay.
Some of them do, some don't. I mean, as a diabetic, it's harder for you to heal, so they would rather a podiatrist do it, and it's covered by the
I was
insurance.
gonna say, and you're covered by insurance if you have diabetes, right?
Yeah.
Okay. Interesting. And so that would be another question, another point. Does their medical plan or treatment plan change based on certain medical diagnosis?
It can, depending on how well they're taking care of their feet.
Okay.
You could have calluses and be diabetic, so it'll change with that because then we'll have to see you more often. Because why are you getting calluses? And it can turn into like open sores, which can cause amputations because you're not healing properly. So sometimes it changes, sometimes it doesn't.
Yeah. And do you all collaborate with your patients, other medical professionals, to kind of come up with certain medical plans?
I personally don't,
Mhm.
but the doctor does have colleagues he does speak with when he's unsure of something, and they figure something out amongst each other.
Okay. All right. That's good. I mean, it sounds like it's a very pleasurable experience for you, being able to help. Yeah. Yeah. I mean, you're thinking about keeping going in the field.
Yeah.
Yeah.
If you do continue your education and go on to be a registered nurse, would you like to still focus in this area of podiatry? Do you think you might do something different?
I think I would want to branch off to like internal medicine or family practice.
Yeah. Okay.
So where I'm dealing with a wide variety of like youth and then youth and older adults, where I'm not just focusing just on the foot. I can focus on the rest of the body and use the stuff that I learned in school.
I was just gonna say, but being able to have that in your tool belt is like you have that, right? You have that
Yeah.
kind of that specialty that you have that you know a little bit more than maybe your colleagues might.
About the foot, yes,
Yeah.
definitely.
And what are your work hours like?
We do all day. We're more day. No weekends, all during the weekdays. So we work from 8 to 5 every day, and on Fridays it's from 8 to 12.
Okay. That's nice.
And are you making calls afterwards? Like I know if you call the doctor's office and like they're busy with a patient, then the receptionist may ask for you to leave a message for the nurse. Are you that person that may return calls?
I do not return calls, but I do answer calls. I work as a receptionist as well as a medical assistant, so I do both.
Okay.
So I'll set up appointments or put insurances and stuff in the computer. So I do both. I answer calls and questions.
You wear a lot of hats.
Yes.
Yeah. And so that scheduling, is that like a certain system that you learned on site?
Yes, it's a different system. Every system is different. The doctor has his own system that he pays for. So it's not the same as all the other systems at the bigger hospitals.
Right.
So it's pretty easy to deal with.
Yeah.
It's not too bad.
That's good.
It is good. What about like maintaining the medical space in the office? Your team is small there. Do you all kind of work together to for sanitation and things like that with COVID, precautions? Do you all work together to keep that up to par? What does that look like?
Yeah, we work together. So after each patient, we disinfect the rooms, and it'll be either me or the receptionist that does it. And then once that's done, then we'll place another patient in the room.
Okay.
So yeah, we work together, but me mainly, I do most of the disinfecting. So.
And then, is there new procedures? Well, I guess you didn't start this till after COVID had started, but is there? Maybe you know this or maybe you don't. Is this a new procedure you use in disinfecting? Not that you didn't disinfect before, but is there something different that's done now that you're aware of?
No, not that I know of.
Okay.
I think they're using the same method that they were using prior to.
Okay.
Yeah.
Which makes sense in a medical office. Yeah. Okay.
Yeah. So, any final advice for young adults who are seeking jobs or careers in medical field that you would have any advice for?
Yeah, just go for it.
Yeah.
Just go for it and try and stay as focused as possible, and always push yourself to do better. Yeah, as long as you push yourself to do better, you can do it.
Absolutely. Well, thank you so much, Jamara, for joining us today for our Career Pathways series. We appreciate your time.
Thank you.
Okay.